On today's episode of IteachMedic, I want to talk about something that's very close to my heart, no pun intended. Why is high blood pressure killing young Nigerians silently? And are you at risk? Every 10 minutes, a Nigerian dies from hypertension complications. Many of them are under the age of 40, and they had no idea they were at risk. So, how many Nigerians are affected? I know we've all heard of blood pressure, but do we really know how it works and what a normal reading is? Your blood pressure is the force of blood pushing against the walls of arteries. It is measured in millimeters of mercury and expressed as to numbers over a period of time. The top number, which is the systolic pressure, represents the pressure when your heart beats and pumps out blood. The bottom number, which is the diastolic pressure, represents the pressure when your heart is at rest between beats. A normal blood pressure reading is less than 120 over 80 millimeters of mercury. Now let's talk about the silent killer part. Hypertension is called the silent killer because it often doesn't cause any symptoms, yet it can silently and steadily damage your arteries and organs, making it a major risk factor for heart disease, stroke, kidney disease, and eye problems. So, why is hypertension on the rise among young Nigerians? One of the factors contributing to the rise in hypertension among young Nigerians is the increasing rate of lifestyle-related conditions such as obesity and diabetes. Also, as the Nigerian diet becomes more westernized with processed foods, sugary drinks, and unhealthy fats, the incidence of hypertension is on the rise. Furthermore, the high levels of stress and lack of physical activity among young people contribute to the problem. Hypertension may be on the rise, but knowledge is power. By understanding the risks and taking proactive steps, you can safeguard your heart health. Do you know anyone who is at risk of hypertension? Share this video with them so they, too, can take action. Together, we can fight the silent killer and live healthier lives. Have you heard? One cause of death in Nigeria is hypertension? Do you know that hypertension has no symptoms? That's why it's called the silent killer. It has no symptoms. But I said that if you are not at risk, you should consider yourself lucky. Many people think that high blood pressure is something that happens when you are old. Well, you're wrong because many young people also suffer from hypertension. In fact, it has become so common among young people that doctors call it hypertension. Hypertension may be silent, but you don't have to be. Protect your heart, check your blood pressure, and share this knowledge. Did you know that hypertension can kill you silently without you even knowing? Yes, that's why they call it the silent killer. And it is killing many people, especially young people. Many people do not know that they have high blood pressure until one day they just collapse and die. What is high blood pressure? High blood pressure is a condition in which your heart is working harder than normal to pump blood to all parts of your body. When this happens, your arteries are affected the most. Over time, the force of the blood pushing against the artery walls can make the arteries stiff and thick. This makes it difficult for the blood to flow through the arteries. If you have hypertension, you may feel fine most of the time, but you could be putting extra strain on your heart and increasing your risk of heart disease, stroke, and kidney disease. The only way to know if you have high blood pressure is to measure it. Normal blood pressure is when the top number systolic pressure is less than 120 and the bottom number diastolic pressure is less than 80 mmHg. If the top number is between 120 and 139, or the bottom number is between 80 and 109, you have pre-hypertension. If the top number is 140 over 90 or higher, you have hypertension. You may not be aware that you have hypertension because it usually does not cause any noticeable symptoms. This is why it is known as the silent killer. However, hypertension can damage your organs and arteries without you knowing it. Over time, hypertension can cause heart disease, stroke, and kidney failure. Who is at risk of hypertension? Anyone can develop hypertension regardless of age, sex, or lifestyle. However, some factors can increase your risk of developing hypertension, such as having a family history of hypertension, being overweight, eating unhealthy foods, drinking alcohol in excess, and smoking cigarettes. Also, stress and lack of physical activity can contribute to hypertension. What are the signs and symptoms of hypertension? Since hypertension is often called the silent killer, it means that it does not cause any signs or symptoms. However, when hypertension becomes severe, it can cause headaches, nosebleeds, shortness of breath, palpitations, tremors, anxiety, and blurred vision. How do you treat hypertension? If you have been diagnosed with hypertension, there are several things you can do to control it. Make sure to follow your doctor's treatment plan. This may include taking medication as well as making lifestyle changes. Some of the things you can do to help lower your blood pressure include eating a healthy diet, exercising regularly, getting enough sleep, managing stress, and avoiding alcohol and tobacco. As you wait for your appointment, I want you to make a commitment to your health. Promise yourself to take charge of your health and do what is necessary to protect your heart. I want you to know that you are in charge of your health and it is up to you to make the necessary changes to protect your heart. I am here to tell you that you are in charge of your health. So take charge of your health right now and promise yourself to do whatever it takes to protect your heart. Hypertension may be silent, but you don't have to be. Protect your heart, check your blood pressure, and share this knowledge. There are some medical conditions that can cause your blood pressure to rise, such as kidney disease, thyroid disease, and sleep apnea. There are also some medications that can raise your blood pressure, such as decongestants, birth control pills, and some antidepressants. What increases your risk of hypertension? Several factors can increase your risk of developing hypertension, such as age, sex, family history, weight, and lifestyle. As you get older, your risk of hypertension increases. This is because the arteries become less elastic as you age, which can make it harder for the heart to pump blood through them. Hypertension is also more common in men than in women. The risk of hypertension increases if you have a family history of the condition. This is because hypertension can be caused by genetic factors. If you are overweight, you are at increased risk of hypertension. This is because carrying extra weight makes the heart work harder to pump blood throughout your body. People who do not exercise regularly are also at increased risk of hypertension. People who eat a diet high in salt and saturated fat are also at increased risk. Drinking alcohol in excess and smoking cigarettes can also cause blood pressure to rise. What are the risk factors for hypertension? There are several risk factors that can increase your chances of developing hypertension. These risk factors can be divided into two categories: non-modifiable and modifiable. Non-modifiable risk factors are those that cannot be changed, such as age, sex, and family history. Modifiable risk factors are those that can be changed, such as weight, lifestyle, and medical conditions. How does hypertension affect the body? When left untreated, hypertension can cause serious damage to the body. It can cause heart disease, stroke, and kidney failure. Hypertension can also cause damage to the eyes, ears, and brain. How do you prevent hypertension? There are several things you can do to prevent hypertension, such as eating a healthy diet, exercising regularly, and maintaining a healthy weight. You should also avoid smoking and drinking alcohol in excess. Can hypertension be cured? Unfortunately, hypertension cannot be cured, but it can be controlled. If you have hypertension, you must follow your doctor's treatment plan. This may include taking medicine as well as making lifestyle changes. Some of the things you can do to help lower your blood pressure include eating a healthy diet, exercising regularly, getting enough sleep, managing stress, and avoiding alcohol and tobacco. What can you do to protect your heart from hypertension? Number 1. Eat a balanced diet rich in fruits, vegetables, and whole grains. Reduce your intake of salt, sugar, and saturated fats. No. 2. Engage in regular physical activity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 3. Maintain a healthy weight. If you are overweight or obese, even a small amount of weight loss can make a difference. 4. Manage stress through techniques such as deep breathing, yoga, or meditation. And 5. If you have hypertension, take your medication as prescribed by your doctor and monitor your blood pressure regularly. Remember, hypertension may be silent, but you don't have to be. Protect your heart, check your blood pressure, and share this knowledge. IteachMedics. IteachMedics, where medical education meets. If you found this video helpful, don't forget to like this video. If you liked it, leave a comment in the comments section below, share with your friends and family. And if you haven't subscribed to our channel, what are you waiting for? Go ahead and subscribe so that you don't miss out on awesome videos like this. Thank you for watching.